Hello and welcome everyone to our community conversation event for August 13th, hosted by the County of Marin and Marin Health and Human Services. I'm Lainey Hendricks, Public Information Officer for the County of Marin, and I'll be your moderator for this afternoon. Today, we're going to cover a wide range of topics related to our COVID-19 response, from masks to testing to community spread and health order enforcement and everything in between. As a reminder, you can find the latest information about COVID-19 activity in Marin, including health order guidelines, testing, mask, do's and don'ts, all of that by visiting coronavirus.marinhhs.org. And on that webpage, you can also sign up to receive daily status updates, which contain an overview of confirmed case data and other updates about Marin's response to the COVID-19 pandemic. To receive those updates by email, you can visit coronavirus.marinhhs.org/subscribe, or to get them by text message, simply text the phrase Marin COVID to 468-311. Well, today's event is titled All Things COVID-19. Unlike past events where there was a predetermined theme, we decided to open it up to our public to submit questions on whatever topic they desired, like a true town hall. More than 50 people took us up on that offer, and we're excited to have two members of Marin's COVID-19 response team here to answer your questions. Today we have Dr. Matt Willis, Marin's Public Health Officer, and Angela Nicholson, who is our Assistant County Administrator, County of Marin, and serves as Director of Marin's Emergency Operations Center. So before we dive into questions, Dr. Matt, can you provide us with a brief update on the situation here in Marin?
Yeah, I'm happy to. Thank you, Lainey. Good afternoon, everyone. It's great to be here with you. I'm going to share my screen. So I'm going to provide 15 to 20 minutes of just an overview of the status of our COVID-19 experience in Marin County thus far, and identify some of the key priorities and strategies that we're working on this week. Our cumulative case rates in Marin since the start. Thinking back to early March, our first cases were was a gentleman who was a Diamond Princess cruise ship member who was our first case, and also unfortunately our first fatality. And it's been since then we've had 3,351 cases in Marin, and we're about 160 days into our the mobilization of our emergency response system. This is our current, as of August 12th, we have tested almost 60,000 residents, and we've had 122 hospitalizations thus far total, with 56 deaths. Right now, where there are, as of yesterday, there were 14 cases in the hospital, 12 of community patients and 2 among San Quentin inmates. That number today is down to 10 people who are in the hospital, which is the lowest number of people we've had in the hospital since late June. Almost two months, we've had higher hospitalization rates, and the average number since June has been about 24. So we are making progress if we can use hospitalization rates as a marker of our success. This is our total tests that are performed each day, and the results. Unfortunately, that shaded area on the right signifies what many may be aware of as a glitch that occurred at the state level last week, where over 300,000 cases got hung up in a data log jam in the CalReady system, and that is still in the process of being fixed. We at the local level were less affected by that in Marin County than many other jurisdictions because we have direct reporting relationships with most of our laboratories, but we also rely on that CalReady system for some portion of the results that we receive, especially negative results from further back. And so we have suspended reporting our percent positive, for example, if anyone's been looking for that and maybe frustrated not to see that updated. That's been frozen because we're waiting for the state to fix the data issue so that we are more confident in both the numerator and the denominator, because we're looking at proportions, to offer a more accurate response for you in the community. This is the demographics of our cases here in Marin, and what this shows on the left column there is our total breakdown of our community by age group, and then hospitalization rates and deaths by how those correspond to those different age groups. And what it shows importantly is that 96% of our deaths in Marin are among people aged 65 or greater, and 70% are among people aged 80 or greater. So Marin is having a, if you will, an exaggerated experience of what's being seen nationally, where we know that nationally there's a higher proportion of older individuals who are at higher risk of mortality, but in Marin that is even more pronounced. And this also shows similar breakdown demographically, this time by race, ethnicity, and what it shows is that while 16% of our community are people who identified as Hispanic or Latino, they make up a full 75% of our cases. And this has been one of the most important features of our experience of the epidemic and has driven a lot of our strategies to address this issue. And again, this is also an exaggerated version of what's been the experience nationally and across the state of California. And I'll get into our specific response later in the presentation. This shows our hospitalization rates compared to other counties. We do have, if anyone's looking, you'll see that our case rates are among the highest in the Bay Area. Right now, that number per 100,000 per 100,000 residents over the past 14 days, which is the standardized way that we measure case rates, for Marin is about 160. Which is one of the higher in the Bay Area. But when we look at hospitalization rates, what we see is that our hospitalization rates are actually lower than most other Bay Area counties. And if we take today's numbers, which is 10 in the hospital, we actually have the lowest hospitalization rate of any county in the Bay Area. This is we've been looking at modeling in the background. Health officers and as an epidemiologist, it's always important to see what the forecasts are based on models that have been built. That is a science that is still evolving, and we've been misled by modeling in the past. And so we've been cautious in how we interpret models. I'm sharing with you this model, which is now the latest methodology is to actually collect 10 different modeling methodologies into a single aggregate score for us. And it's getting more reliable. And what I'm sharing with you here is a modeled estimate of the rate of transmission in Marin County. And what's important there, that line 1, the dotted line there, corresponds to if each person who was infected one other person, you might imagine that our case rates would maintain the same over time. If each person that's infected infects more than one person, then you have more cases over time. If everyone infected 5 others, you have geometric, the growth is obviously much higher. If you can get that rate of infection below 1, that begins to decrease our case count sequentially over time, because the virus, what it means is that the virus is not finding another host, is not actually infecting another person with each case. And this shows that right now in Marin County, it's estimated that each case is only infecting less than one other person. So that is a sign to us that we might be expecting to see increasing progress and lower case counts over time. I want to be really cautious in not being overly optimistic or celebrate prematurely there. We don't want to be falsely reassured by this, but I also know that we've been working on this really hard together, and this has been going on for a long time, and this may be something as a sign of the success that we're having, and we'll be watching this very closely. And I'll be sharing our effective moving forward. This number. Now, those are the key numbers I wanted to share with you. Now we'll just get to our shelter-in-place order. This is by way of update of some of our strategies. So we are on the state monitoring list. We've talked about this before. The California Department of Public Health has established a list of counties based on incidents that they are watching. It depends. It sets the stage for what we can and can't do in terms of opening different sectors and when we might. That number that we're looking at is more than 100 cases per 100,000 residents over the past 2 weeks. And we are now, again, as I said, at about 160. So we're on the monitoring list. The vast majority of California residents are on that list. More than 90% of people live in counties that are on the monitoring list. Yesterday, or the day before yesterday, we opened personal services, outdoors only, including nail salons, massage, estheticians, and facials. And that was something that was allowed, available to us as an option, despite being on the monitoring list. Tattoos and body piercing are not allowed for monitoring list counties. And then our plan is for August 24th to move forward with hotels and short-term rentals, as long as the countywide incidence is below 200 cases per 100,000 residents. So on August 21, which is a Friday, we'll look back at the previous 2 weeks, and if our rate is below 200, on that following Monday, we will open hotels and short-term rentals. And at that point, then we will be aligned with the state for anything that the state allows any county on the monitoring list to do, and we'll be tied to the state level at that point. Schools. There's been obviously a lot of interest and conversations about schools nationally over the past few weeks, and in Marin, our options are really determined primarily by our case rates. So just to review that with you briefly, we have case rates, when we have case rates below 100 per 100,000, so once we get off of that monitoring list, schools may open to classroom-based learning. When the case rates are between 100 and 200 cases per 100,000, TK through 6th grade may open with the approval of the local public health officer through a waiver application process. And then if we have more than 200 cases per 100,000, then we would not be able to open schools regardless, even with the waiver. So the waiver application is, we've had several conversations with the school community over the past few days, outlining the waiver application process. The waiver application itself will be released tomorrow to schools that seek to apply. We are finalizing the application. Any schools that have applied thus far are going to need to reapply once they have the actual finalized waiver. The waiver application needs to demonstrate adherence to the guidelines and recommendations that we co-developed with Marin County Public Health and Marin County Office of Education. We'll need to include a school site specific protection plan. According with, Marin recovers, all businesses and all agencies and sectors that have been able to open have to have a site specific protection plan, and that is also true for schools. And that plan in this case follows those 30 points of the recommendations that we came up with for safe reopening. And that will be attached to the waiver application. They also need to indicate the way in which schools intend to provide COVID-19 testing for staff and for students if there are cases. We will prioritize those that can optimize outdoor space, because we know that's safer than indoors, and those that have a demonstrated commitment to educational equity. I'll get into that more in a bit. The earliest any school would open in Marin County would be September 8th, which is the day after Labor Day. And we'll be watching the numbers very carefully to determine whether or not we think that's a step we can take. Important concerns around equity. Health equity, educational equity has always been a priority for us as a county, and for us from public health. We recognize that public health is about physical, mental, and social well-being, and not simply the absence of disease. And so we're taking a more holistic view on reopening schools. We recognize that the 2021 school year could widen unacceptable inequities in education because distance learning has disproportionately hurt low-income families. We're also seeing that public schools are less likely to apply for waivers to open than private schools. Almost all the waiver applications that or schools that have signaled that they intend to apply thus far are private schools. We also know that families of means are finding alternatives in ad hoc learning pods with instruction. People are able to gather groups of children together and hire an instructor to ensure that their education is protected during these years during these months where they may be in a distance learning mode. And that opportunity is differentially experienced by income, and our low-income families don't always have that same option. We also see that there are unstructured out-of-classroom arrangements that are being made in learning hubs or pods or in day camp or care that could actually increase risk of transmission in the absence of that structure that classroom-based learning offers. And so these are all considerations that we need to have our eyes wide open as we come into this school year, recognizing these realities. These are opportunities to drive. So the main point here is what's bolded there, is this is an invitation for all of us to drive down the transmission of COVID-19 in Marin County to allow all schools to open. The most important factor that will allow us to resume classroom-based education is our community prevalence. And that's something we all have some control over. And so as a matter of social responsibility and welfare, we can all do our part to allow our kids to get back into school where we know it's healthiest for them. We are going to ensure the waiver application process supports equity. We're supporting out-of-classroom educational structures for low-income children. And we want to ensure that all schools are prepared for reopening as safely as possible, following those 30 points in our recommendations. Finally, I'll end with just a brief review of our canal outbreak response. As I indicated, 16% of our population are people who identify as Latinx, 75% of our cases. The community that is most affected by that is the Canal District in San Rafael. And we've recognized that as this outbreak has become, has accelerated and become more complex, that we've needed a more coordinated interagency approach to tackle that. And our goal is to flatten the curve in the canal area of San Rafael. And so these are the partners: Health and Human Services, the City of San Rafael, Kaiser Permanente, the Canal Alliance, Marin Community Clinics, and Marin Health are just some of the key partners that have come together in this new interagency collaboration designed in mid-July that has really with weekly meetings to sort of describe the challenges that we all experience and recognize that everyone brings a different tool to the table, and we can have a more coordinated, integrated response through regular collaboration. The goal is improved coordination across partners and teams, diverse community stakeholders and influencers. We're making sure that the voices of the canal, with Canal Alliance, Marin Community Clinics, and other partners who are embedded in that community are taking leadership and guiding the process. And we are working on health education and really focusing on the audience and the community itself to ensure that our messaging is aligned with the needs there. This is just a reminder of why this work is so important, because of the disproportionate effect in that community. There are action teams, 7 different action teams that have been organized for this. There's one around epidemiology, just to describe, we need to be data-driven in everything we do. So we're describing the problem as specifically as we can, so we know that we're solving for the right issues. We have a team based on outreach in the community, working with faith-based organizations, community-based organizations, et cetera. We have a health education team that is working on educational materials and is training promotores from within that community. A communication team that's developing strategies to increase awareness and engage media and other influencers in that community. We have a partnership team that is dedicated to business and commerce. We have a testing team, recognizing that barriers to testing has been an important challenge for us. And then a team dedicated to coordinating isolation and quarantine activities. Obviously, we want to start by really understanding what the community is experiencing in terms of the challenges and access to the services that we think we may be offering, but there may be barriers. And that was a survey. We are partway through and have a lot of responses, enough so that we can actually start, giving you some of the results. About 600 responses so far to this community survey. And what we found, I'll just share with some of the key results so far. The majority of respondents believe that COVID-19 is a serious threat to their family, but would not be able to properly quarantine at home or go to Novato because it's too far. So the recommendation there was to identify a hotel in the canal area, and that has in fact been secured. We now have a hotel in the canal area for isolating and quarantine people from within that community. We know that we learned the majority of respondents were getting their news from Telemundo and Univision, so have formed relationships with those media outlets. 1 in 4 respondents got at least one COVID-19 fact wrong. We recognize there's a lot of other sources of information that might be misleading people, and so we have a campaign to try and make sure that the facts are understood. We also identified some other concerns that are barriers to testing. 18% feared missing work if they're positive, 15% fear immigration status issues, 30% fear losing housing if they're identified as positive, and about similar percent don't believe that they can afford testing, despite the fact that we're offering free testing. So these are really clear opportunities for us to clarify our messaging and offer reassurance where we can and identify what some of the real barriers are. I'm just going to offer some of our initial successes in this, because I know this has been an increasingly concerning aspect of our outbreak experience in Marin, not just for the Canal area, but for all of us. We've increased Spanish language media engagement with the weekly Canal-specific radio outreach across multiple programs. We, as I mentioned, secured a hotel on the Canal for quarantine and isolation. We've improved testing access. There's testing 6 days per week in walking distance for anyone in the Canal. Marin Community Clinics has been a valuable partner. They serve over 30,000 individuals in this community of our low-income residents. And they have improved testing turnaround. We're offering 2-day testing turnaround using our color testing option for that community. We're also doing antibody testing for Marin Community Clinic patients, as well as rapid testing with in partnership with Marin Health for that 15-minute rapid Abbott test. A Why I Mask campaign, over 600 posters in key areas and on buses. We're hiring contact tracers from within that community. There's been a training video for Canal businesses to craft what I mentioned, that site-specific protection plan. The Marin Strong campaign. This is an exciting initiative where a Canal-owned and operated business called Equipe is making cloth masks. And Marin County, City of Santa Fe and Kaiser are providing seed funds. Masks will be distributed free in the Canal, and we'll have links for individuals to purchase. So we encourage anyone, once that link is up, to actually go online and purchase masks that are being made for Canal residents from within the Canal. And then finally, a safe recreation campaign, working with Santa Fe Recreation to promote self-recreation, Pickleweed Park and other areas. These are some of the materials that have been developed based on what we learned from the survey in terms of what people feel they need most in terms of information, and really image-based rather than word-based communications, based on the diversity of, it's not just Spanish speaking, but many people are from other indigenous groups where Spanish may in fact be a second language. So really relying on images as well. These are some of the clarifying the facts versus the myths. For example, on the upper left there, the rumor was chlorine dioxide can treat COVID-19. Wanted to make sure that that's something that people don't actually use bleach. And so offering that as a clear communication. And I'll end with the Why I Mask campaign. These are, you may recognize some of these faces. These are some of our most important and trusted community leaders and influencers demonstrating why they mask. And this is a campaign that's been distributed throughout the Canal and on buses throughout the county. So those are just some of the elements, or the most important elements of the Canal outbreak response plan. And our goal again is to reduce that curve in the Canal by the end of this month. And we also want to test at least half the Canal residents by the end of August. And we're well on our way towards that goal. Thank you. And that concludes my update. And we can get into some of the rapid fire questions that Lainey has assembled from you all. Thanks.
Wonderful. Thank you, Dr. Willis, for that really well-rounded overview in terms of what our response looks like. And thank you again for the update about the Canal, especially. It's really exciting to see the partnership that's underway there not only with health-related organizations, but a lot of community-based organizations, many of whom we've had as presenters in past community conversations. So we're glad we can touch on that again. So for those of you that are watching and maybe joined us a little late, this is our community conversation event hosted by the County of Marin and Marin Health and Human Services. And today we are joined by Dr. Matt Willis, Marin's Public Health Officer, and Angela Nicholson, Director of Marin's Emergency Operations Center. Now, let's dive into the questions that were submitted by our very own local residents. So we know that August is back to school season, and so it felt most appropriate to start with questions in that category. And there were quite a few questions submitted about schools as well as childcare related questions, but let's start with a couple here. Mike from Sausalito asks, will schools be able to offer their classrooms for small learning pods that are forming to use to meet in order for these small pods to meet?
Yes.
All right, that's short and sweet. And is that contingent on whether or not a school is vying for this waiver process, or is it up to the school, or do they need to talk to the school or district about that?
Yeah, they would need to talk to the school or district about that, and obviously they need to follow the other provisions of how to do that safely. We've come out with the guidance on how to do daycare and childcare. And that's 15 cohorts. One of the most important changes. Most of the guidelines there are the same as they have been since the beginning of the shelter in place, with the pop-up childcare that we offered. But we've increased the cohort size from 12 to 15, and that's the most important, I think, difference. But the physical location of where that can occur can be at a school if the school agrees.
All right, excellent. And since you mentioned the increased cohort size, I know that Marin Public Health did release new guidelines for childcare and youth programs. And so anybody that's interested in learning more about those, you can find those guidelines at marinrecovers.com. Just a quick plug. Okay, next question. Linda asks, how many positive cases have there been in school settings? We see that there's an age range on the coronavirus surveillance page, but they don't really hone in on those child type settings. So how many positive cases have we seen in school settings?
We kept schools open to certain groups as early as in May, mid-May, for some of our special needs groups, and in stable cohorts of 12, and that offered us a demonstration of what this looks like and how we can do this effectively. And what we had is over 6,000 days of experiences of students in those cohorts combined, and twice did we have any cases in that setting, and it was 3 students total. And so we were able to determine when those occurred, do the testing within those groups. We closed those cohorts, and there was a closure for 2 weeks, and then they reopened. And so it really provided us, because we do want to make sure that we're realistic about the fact that reopening schools during a pandemic, we would expect to have some cases in schools, and having clear procedures and policies around how to manage that is something we've been able to really define through our experience in those pilot settings.
Okay, we're going to take a short pause to change our interpretation team. So just hang with us for a moment. Okay, thank you for that quick pause. And thank you for that answer, Dr. Willis. So speaking of schools, we know that how our schools will move forward, as well as how many of our businesses will move forward, really depends on our status on the state's monitoring list. And I know you gave us a few figures earlier. So do you have a question that came in is, is there, if you could guess, I realize you had some modeling there, but if you could guess, how quickly could Marin be off that monitoring list?
Yeah, I wish I knew. I mean, that's our goal is obviously to reduce transmission in Marin County so that we can be off the monitoring list and so that we're better protected as a community. Um, the, you know, the, I'm encouraged by seeing our hospitalization rate be the lowest it's been in almost 2 months. And the modeled transmission rate also is much lower. And so we may we may be off the monitoring list sooner than I would have predicted, say, if you had asked this question a week ago. But it's, if we're at 160 now, it's still a long way to 100. And so it will be weeks at best, but perhaps not months. And again, it's up to us. Ultimately, the answer is that it's up to us to accelerate that as much as we can.
All right, it's up to us, everybody watching and all of your neighbors. So remind everyone at home and everyone you interact with that we all are in this together. Angie wrote in to offer not only a question, but a suggestion. She wrote, it would be really helpful to have a tracker on how we were doing in terms of getting off the watch list. I understand there are 6 criteria, but the data is confusing and we're not sure where to look. The question is Marin Public Health planning to make these 6 criteria that the state is holding us accountable to readily available for the public to see?
Yeah, absolutely. One of the, it's a bit of a moving target in terms of what the state is actually using as the indicator. The state had been using hospitalization rates and a certain proportion of increased hospitalizations as a reason to place the county on the monitoring list. They removed that as an indicator, partly because of the questions around the reliability of that data as it was arriving to the state from counties. And so once that has stabilized in terms of what the final list of metrics that they look to, we will post that. The most important for us remains our raw case, just the case incidence. The number of new cases per day in Marin County is by far the most important indicator for us, and is why we ended up on the watch list in the first place, and is probably the one that is furthest or needs the greatest improvement for us to come off of that watch list. So that you have a mental model for it. It's 19. The number is 19 cases. If we're for a population of 260,000 people, which is the population of Marin, that 100 cases per 100,000 over the past 2 weeks corresponds to 19 cases per day. So our goal is to get down to less than 19 new cases per day in Marin County, and then we'll fall off that list.
All right, excellent. Elizabeth also wrote in with a data question, and she asked if you can please explain why the race and ethnicity charts on the data and surveillance page do not represent 100% of the cases in Marin County.
Yeah, we obviously seek to describe people according to race, ethnicity to make sure that our strategies are aligned with the communities that are most vulnerable. But it is voluntary. When people are tested, usually it's at the level of testing that information is collected. And some individuals choose not to offer that information, and obviously that's their right. So any of that, it's an important caveat, I should have mentioned that earlier, is that any of the data that we're offering around race and ethnicity is among that subset of individuals who have chosen to share that information. And we have no alternative way to determine what that is as a matter of their right to privacy. Okay.
And one more data question before we shift topics. Deborah asked, isn't your 14-day recovered statistic optimistic? Don't many people remain sick much longer and also have long-term health issues?
Yes, that's true. I mean, one of the concerns about this particular disease is the myriad of different organ systems that are involved, and how some people have longer periods of symptoms. What we use that recovered for is for determining infectivity. It's really important for us to know the difference between someone who may be a risk to others versus someone who is not. Those who have longer and more indolent experience of a longer duration of symptoms are generally non-infectious after about 14 days. And so maybe a better term than recovered. I mean, recovered is the sort of the common nomenclature that we use in order to standardize this with others across the nation, and that's the term that is used at the state to signify someone who has gone through that period where they've been infected and they're no longer infectious, and that's generally 2 weeks. And so we use that as a sign of someone who's more than 2 weeks out from their diagnosis, for us to know how many are active and infectious to others in the community.
Okay, that's helpful clarification. Thank you for that. Now, Angela, I don't want you to feel like you were invited just to watch a great discussion between Dr. Willis and myself. And so I want to ask you a few questions as well, especially as it relates to the ordinance that was adopted by the Marin County Board of Supervisors on July 21st, the ordinance that would give local law enforcement and code enforcement agencies a mechanism to be able to cite people and businesses that are in violation of the shelter in place or other important health orders that are that have been issued in light of the pandemic. So Angela, I'm wondering if you can give us an update on the status of the implementation of the ordinance. What has taken place since the Board of Supervisors passed that ordinance?
Sure. So I would be okay sitting by silently and watching the two of you talk, just to put since the board passed the ordinance, we've received about 560 complaints. And the process is really twofold. So on the one hand, we have mask enforcement, and that would be mask enforcement is really dedicated, is being handled by local law enforcement. So local law enforcement and sheriff's office are really, if they see people that are not wearing masks, I think the uniform goal is compliance. I think I want to be clear about that. And I think we want to get people to comply in order to reduce our case rates and our community spread in Marin County. If we seek compliance and a resident is then masks and is following the guidance, typically the law enforcement officer will move on. In the event that they cannot get compliance, then that would be the event that they would potentially use a citation. To date, we've only had a couple of citations issued, and we are still finalizing the last little administrative pieces so that those tickets are fully accessible to law enforcement officers. On the business side, we have SIP violation at marincounty.org. And that's a place that if you see a business that is clearly not in compliance with the shelter in place order, you can send us an email. And then we have a task force model that we're working with local cities. And depending on the type of business, we then contact the business and then we'll have a task force member go out into the business community, greet and meet the business. Again, our goal is compliance. And so if we walk in and we see that there are things that are not being complied with, we talk to the business owner, we're trying to educate, and then we will return a couple of days later to ensure that the defect, whatever that might be, has been cured. And if it hasn't, that would be the event that we would have the citation in our back pocket. Again, I mean, this is really about, I think to Dr. Willis's point earlier, we're trying to get off the watch list. We want to support schools to open. In order to do that, masking is one way for us to restrict community spread. So it's very important that people comply with that order, and the citations are just one tool that we can use to get people to comply with the order.
So that's helpful background. Okay. What has taken place in terms of you mentioned you received 560 complaints from the public, yeah, which is incredible. Walk me through that process. What happens once you receive the complaint, and have any businesses been contacted that complaints have been filed against?
Yeah. So once the complaint is filed, we then have the complaint goes through our legal department to make sure that the complaint actually states an actual violation of the order. And at that point, either we send the complaint directly to the city, or we have our internal task force folks in the county reach out to the business. So we've already started doing that. We reach out to the business. We say that there's been a complaint filed against you. Here's the concerns. And then over the next few days, task force members will be going out into those businesses and saying, okay, here's the complaint we received, and identifying whether or not the business is complying at this point. So we are a few days shy of the task force actually being out on the road, but we are actively cataloging and responding to businesses that we've received complaints about.
Okay, well, and we know that every ordinance, there's a process involved in terms of that a lot of people don't think about. It's not simply just an ordinance and then citing somebody, but there's the appeal process and everything in between. So I'm glad to hear that forward momentum is happening on this effort. So you mentioned a little bit about the personal, and maybe you've covered it to the extent you can, the personal accountability to it. It sounds like, well, let me just get to the question. Bob submitted a question saying, what actions can a concerned citizen take if violations of the mandate are observed? So it sounds like for businesses, it's that email address that you mentioned, sipviolations@marincounty.org.
No, SIP violation without an S. It's important.
Got it.
An important clarification.
Thank you.
But when you submit to that inbox, if you can make sure that you include enough detail. So we've had a lot of people submit, like, I was at Target and this is what happened. Well, there's 3 Targets in the county, so we don't know what that means. So including a date and a time and a place with enough information so that we can actually analyze whether a violation has been made would really, really help. And that's on the business side. I think also people have been submitting like large group events. A reminder that short-term rentals are still not allowed to operate unless they are serving either somebody that's in the rental for more than 30 days or somebody that is an essential employee and needs the housing in order to provide essential services in Marin County. So having parties at a short-term rental would be a violation of our order. And so people are submitting those things as well. And it's a good way for us to look at trend data to figure out if there are places that we need to spend more time enforcing.
Excellent. Okay. Thank you for that update, Angela. That's really helpful information, and we haven't covered the ordinance in any detail in a community conversation, so it's good to get that information out there. So now we're going to shift to the topic of testing. We've received a lot of questions about testing, and so I will go ahead and dive right in. Linda asks, does a COVID-19 test show if someone may have had let me start over there. Does a COVID-19 test show if someone may have had the virus previously? There we go.
It shows if you've had the virus. The COVID-19 test, the conventional PCR test, which is the test when I say we've tested almost 60,000 residents, is a nasal swab. PCR, it looks for the RNA of the DNA of the virus, and it's a sign of active infection. It shows that you've got live virus in your nasal passages, and that's the. So it doesn't tell us. Yes, it tells us if you have an active and if you've been infected in the last few days. It doesn't tell you about historical. You may have been if you were infected 2 months ago. You're not. That test isn't going to tell us a lot about that. That would be a different type of test, and that would be an antibody test that measures your body's immune response to having been infected, and that's a test that is not yet used widely because it has limitations and is not used for diagnosis.
Got it. All right. Next question here. If person B is exposed to person A who has COVID, how soon can person B be tested to see if they are infected? Or maybe it should say, how soon should they be tested? Okay.
Yeah, so person B, I think if I've got them right, so person B is the exposee, is the one that was exposed. It generally takes 3 to 5 days to develop symptoms. So we don't, and that's a good question, because sometimes people feel like, oh, I think I was exposed. I need a test right now. And the answer is, wait, give it probably 5 days, 5 to 7 days is kind of the earliest to determine whether or not that given exposure might have led to an infection, because it takes that long for the virus particles to amplify enough in your nasal passages, if you were infected, for it to be detectable on a test.
Interesting. Okay. Jessica asks, are we going to get rapid testing for our entire community anytime soon?
Yeah, I mean, I think that if the spirit of that is that the turnaround times are too long, that's definitely true. So there's the PCR testing, which is the most accurate type of testing that I described with the nasal passages and looking at the DNA or the RNA of the virus. You can get a 1 to 2 day turnaround on that test by sending it to a laboratory for processing. There's another type of actually very rapid turnaround, which are on-site testing, where you may have heard, the Abbott machine or others, where you have about a 15 minute turnaround. The trade-off for those rapid point of care testing is that the accuracy is limited, especially the risk of false negatives. And false negatives, you can imagine, are a problem in a lot of settings, because you end up with a negative result that says you're not infected, when in fact you may be infectious. And so that's really limits the utility of that kind of testing for most of our settings. It's also the machinery is just a challenge. You can only do, most cases you can do one test every 15 minutes. So large, you can imagine we're doing almost 800 tests per day in Marin County using the PCR test. And those rapid tests where you can only do one at a time would never keep up with that level of volume. So the answer is that we don't have right now the technology based on the way the tests are performed and their performance characteristics, the risk of false negatives, really limit the utility of rapid testing for us now. There are some applications and we use them in some settings.
Got it. So technology and accuracy are stumbling blocks until we can, for rapid testing in Marin. All right. Let's see, Jane from Point Reyes asked, well, what good is testing community members when the results are not returned until up to 2 weeks later? You have a response for that, Dr. Willis?
Yeah. I mean, I agree. I think we share the frustration that we've all experienced with the national experience of limited testing capacity. If I can think of one thing that sort of signifies that we're all inheriting a failed national plan to this pandemic, it's the testing environment. And it's been frustrating, I think, as a local health officer, to recognize that this is a disease that's diagnosed through testing. And despite all of our efforts, we have some of the highest testing rates of any county, and have invested in testing. With some of the most sort of common private testing companies like Quest have experienced real shortages nationally in terms of the reagents and the instruments, where we're having 7 to 10 plus day turnarounds on the testing. And the answer is, specific answer to that question is that there's very little, frankly, there's very little value to doing a test where it takes 2 weeks to get back, because you're that person by that point is out of their period of infectivity. So if at the point the test was taken, if we knew that it was going to take 2 weeks for the result to get back, we might say, let's just treat this differently. Let's assume that you've been exposed. Go for an alternative method, a clinical, do a clinical assessment to determine the likelihood of infectivity or transmission, and take it from there rather than waiting for a test result. So the good news is that seems that turnarounds are getting better, and we're also even in those historically really challenged testing environments like the Quest, and we're also through current color testing, color genomics. This is a longer answer. Sorry. We have a testing firm now that we're using in Marin, 300 tests per day with color. They test a 1 to 2 day turnaround, and we're shunting people who really need that more rapid turnaround into that resource. And we're finding ways to work around the problems of long turnarounds that some of the agencies or some of the testing operations are experiencing.
Well, the long answer was okay, because you answered the next question, which was, what is the average turnaround time for testing? So it sounds like it's getting better in Marin. But as a follow-up to your answer, you mentioned wanting to prioritize testing, it sounded like, for people that needed to get it. So can you elaborate? You mentioned kind of shunting people into testing. Who are you targeting in terms of those people that should get the testing that's more readily available in terms of the quick turnaround times?
Yeah, I mean, it's people who are having symptoms. Anyone who's having symptoms of COVID-19 is obviously at a higher risk of being infected, and also being infectious. Asymptomatic people tend to be maybe less infectious to others than people who are experiencing symptoms. And so that's one criteria. The other is people who are in occupations where, or in settings where if they were infectious, there would be more serious consequences. For example, the best example of that is people who work as staff in residential care facilities for the elderly or skilled nursing facilities. One of the biggest challenges that we're experiencing as a county right now is outbreaks, as it's being experienced across the state, outbreaks in long-term care facilities. And it's almost always staff who bring it in from the community, often asymptomatic. So that's another group that we would prioritize for testing as a subset of our essential workers. Another group we would prioritize is people who are more likely to have a bad outcome, to be more ill if they become infected. So that's our older population, or people who have chronic diseases. Those are and we're now gating more specifically when people are seeking testing, to make sure that it's not a test that someone who's otherwise healthy wants because they want to take a trip. As much as that may be seen as a community service, we really need to prioritize our limited testing resources for those people who need it most and would be most harmed in the absence of a diagnosis.
Great. Thank you for clarifying that. All right, let's shift gears again. I realize we have about 7 minutes left and we have a few more questions to cover. And so looking at more of a community spread themed question, Lisa asks, and this is a longer question, so hang with me. Exposure to air pollutants in wildfire smoke can irritate lungs, cause inflammation, alter immune function, and increase susceptibility to respiratory infections, likely including COVID-19. Based on this new information, will the health department order that Marin residents no longer operate burning fireplaces during the pandemic as the upcoming cold season and increased fireplace use occur?
Wow. So there is, the air district. So the quality of the air is regulated by the air district, and there's a process for ensuring that on days where there may be more particulate matter, that there's steps taken to spare the air days where you're not allowed to have fires for that particular purpose. But that question, it is true that one of the most important symptoms of COVID-19 and respiratory, when people pass from COVID-19 pneumonia, it's obviously because it's affecting their ability to breathe. So respiratory health is important when this virus is part of our community. And I think a more common threat to us would be smoking and vaping. Those are things that also we know have a very clear harm to our lungs, and people who are infected with COVID-19 who have a history of smoking or vaping are at much higher risk of bad outcomes.
Okay. Somewhat related to air quality, this is a stretch. Let's shift over to masks. We have a mask-related question from another Lisa. We have a lot of Lisas today asking questions. And she writes, I have recently seen studies that show if 90% of people wear masks, we can reduce the number of deaths estimated by December 1st significantly, but there will still be a large number of COVID deaths. If masks prevent COVID and we all wore masks, what other ways would people contract the virus?
Yeah, that's a great question. The fact is that masks are, if people ask, what can we do? What can we do to support small businesses? Who are struggling economically? What can we do to support schools to reopen? What can we do to prevent people from getting sick? The answers all converge at the same basic stuff, which is covering our faces and respecting the physical distance. Covering our face, having said that, we're not guaranteeing that, 100% that you never, if you're covering your face and you're closer by, or if someone sneezes while they have their mask on, there's still a chance that some of the virus would go. Think about the way we think about seatbelts or other things where, wearing a seatbelt isn't a guarantee that you won't be injured in a car accident, but it improves your chances so much. And that's how we approach facial covering. And so the fact is that if we all covered our faces more reliably, there would be still maybe a few odd sporadic moments where someone may be infected despite that, but they would be so rare compared to the alternative. And that R effective that I described in terms of the number of people who would drop so low if we were all covering our faces, that the rate of transmission in the community would drop very quickly. So it's not a guarantee 100%, but it is definitely the best way for us to get off the monitoring list and get back to normal.
Excellent advice. So Marin residents who are watching this, cover your face whenever you leave your home, remind your neighbors to do the same, be cordial about it, and continue to practice all those protective measures so we can hopefully get off this monitoring list as quickly as possible. All right, well, I think we are about out of time. I do want to thank our two guests today, Dr. Matt Willis, Marin's Public Health Officer, as well as Angela Nicholson, Director of Marin's Emergency Operations Center. It was a pleasure to have you back and to help answer questions that we received from our public. If any of you submitted questions and they were not answered, feel free to reach out to us. Actually, I believe our contact team plans on getting back to you so that your answers will be your questions will be answered. So that is a luxury. If you did not get a chance to submit a question, but you still would like to ask one, remember that our COVID-19 response team is available to you Monday through Friday. You can reach them by calling our hotline at 415-473-7191, and our team is there to answer your questions from 9:30 to noon and from 1 to 5 Monday through Friday. You can also contact us by email through our web contact form. So visit coronavirus.marinhhs.org/contact, drop your question there, and you should hear back from a member of our coronavirus response team within 2 to 3 business days. I want to thank all of you for watching. This session was recorded, so you'll be able to watch it immediately on Facebook, and we'll have it on our YouTube channel later this afternoon, and it will be included in tomorrow's status update as well. Remember, your #1 source for all things COVID-19 in Marin is Marin HHS's website, which is coronavirus.marinhhs.org. We look forward to having another community conversation with you again in the future. Until then, thank you for watching and stay healthy, Marin.